Without a firm foundation, the most expensive house on the market will eventually collapse, and sooner rather than later. And the same thing applies to your body. All of the most potent pharmaceutical interventions in the world will not be nearly as effective when they are put to work in a weakened, debilitated body. And this is true for testosterone replacement therapy as well. Granted, testosterone will help anyone regardless of their current physical condition. But to ensure that you will receive the maximum benefit from testosterone replacement therapy, it is crucial to be in the best possible physical condition that you can attain. For men with low T, restoring healthy testosterone levels is of critical importance to create the groundwork for a healthier life. It's also important to understand what risk factors are most likely to lead to testosterone deficiency. A recent study in the Journal of Clinical Endocrinology sought to improve our knowledge regarding what men are most at risk for. This study, led by Professor and Dr. Bu Yeep from the University of Western Australia, demonstrates how lifestyle, BMI, age, medical status, and socio-demographic circumstances all influence the chance of a man to experience testosterone deficiency. While all of these factors have an individual influence, they also act in combination. Dr. Yeep believes that these factors should be considered both before and after testing for hypogonadism in order to best anticipate and meet the needs of the patient. UK Biobank study offers various insights. All individuals analyzed in this study were between the ages of 40 and 69 years old. Researchers gathered evidence from over 200,000 patients that participated in the UK Biobank study between the years of 2006 and 2010. The UK Biobank study aims to evaluate how various diseases are affected by genetics and the environment to enhance medical knowledge and improve outcomes for patients. The UK Biobank will follow the lives of around 500,000 men and women for at least 30 years to achieve this goal, providing a wealth of medical data for scientists and researchers around the globe. Researchers evaluated sex hormone binding globulin levels and serum total testosterone collected from each subject. Vital information was collected through various means, including medical records, blood tests, physicals, and self-report. Participants self-reported medications and demographics. Testosterone, age, and body mass index. The average testosterone levels of participants was 11.6 nanomoles per liter, along with free testosterone levels of 213 pmoles per liter and SHBG concentrations of 36.9 nanomoles per liter. Both BMI and age were strongly correlated with elevated SHBG and suppressed serum testosterone levels. Free testosterone concentrations, on the other hand, improved up to a BMI of 25, then started to decline. BMI and age acted independently with regard to testosterone levels. From age 50 to 70, men can expect to have testosterone drop by about 1/2 nanomoles per liter. The effects of weight are actually more pronounced than age. A man with a clinically obese BMI of 30 is estimated to have T levels around 1.5 nanomoles per liter, below that of a man with a body mass index of 25. Lifestyle factors affected testosterone levels. Lower testosterone levels were associated with higher education and living with a partner. Men of South Asian descent also had lower average testosterone. Smokers, on the other hand, were found to have higher testosterone than those that did not currently have the habit. Men could also be categorized in relation to their diet. The following are ranked from lowest to highest testosterone levels. Vegetarians. Vegetarians have to ensure that they are combining the right type of foods continually to consume sufficient protein, and that can be challenging. Lots of red meat. The toxic additive in non-organic red meat can wreak havoc on testosterone levels. Little red meat. Primarily poultry. Chicken and turkey are excellent sources of protein. Pescatarians. Fish are loaded with lean protein, the type of protein that can swing into action immediately. More exercise is strongly correlated with higher testosterone independent of alcohol use. Alcohol suppresses sex hormone binding globulin levels, but other physical and dietary factors caused testosterone or SHBG to act in similar ways. The effect of diseases and medical conditions on testosterone levels. Various medical issues lead directly to impaired testosterone function. The following conditions led to lower average testosterone levels as compared to men without the condition. COPD. hypertension, kidney impairment, angina, dementia, diabetes, cancer, heart disease. Suppressed SHBG levels were common among patients with hypertension, kidney impairment, angina, diabetes, and heart disease. On the other hand, the only condition associated with increased SHBG/testosterone was atrial fibrillation. With this huge set of data, researchers could hypothesize about testosterone levels based upon the characteristics of a patient. For example, a sedentary man of South Asian descent that is college educated, eats little red meat, and lives with a partner can expect to have testosterone levels around 2 nanomoles per liter lower than average. This is why our clinic takes a comprehensive, holistic approach to your testosterone replacement therapy. We offer the most efficient, cutting-edge testosterone regimens available in today's market. But we don't stop there. We have specific, detailed nutritional planning, a supplement list designed to raise testosterone safely, the best fitness routine tailor-made for you, and tips on getting a deep restorative sleep every night and controlling stress. Contact us for a free, no-obligation discussion. You can contact us by clicking the link below in the description and filling out our contact form or calling our telephone number.